And if you're happy, then we'll give you 5 minutes of reading time, then 15 minutes of case time. Your reading time starts now.
Okay, cool.
So your reading time has finished. The case time will begin, and for this case, I'll be acting as a sim patient. So, hey doc, how you going?
Oh, hello, Jeff. It's first time seeing you. How are you doing?
Yeah, good, thanks. I couldn't get to see my usual doctor, but they said I could get an appointment with you. I'm just here to get my license back so I can get back to driving.
Oh, I see. Yeah, and I hope to help you with that. But first, I need to know a little bit more information from you.
Yeah,
Can
sure.
you tell me? Yeah, in my record it says you're a part-time driver, right? Yeah. So I hope to know what kind of traffic vehicle do you drive?
Yeah, so I've got my usual car. It's just a four-wheel drive that get me around the place. But I'm actually a bus driver, so I drive the school buses for one of the local schools out here.
Okay, I see. Okay, so have you been? I mean, in the past, for driving, how long have you started driving?
Oh, I've driven my whole life. I got my first license right when I was 18 years old, and yeah, it's been a long time since then. So I'm a pretty good driver. No
Oh,
accidents.
yeah.
Yeah,
Okay, I see. That's good to know. And I read that in the record that you recently got heart arrest, and
yeah, yeah.
you've been on medication. Yeah. How are
Oh,
you
they've thrown all kinds
recovering?
of tablets at me. I don't know what half of them do. I just take them.
Oh, okay. Yeah, indeed. I see you're taking 4 tablets. Yeah. Are
Mm.
you taking? I mean, 4 medications. Are you taking all of them every day by according to the instructions?
Yeah, yeah. My wife's fantastic. She's got this little pill box thing that she puts them all in so that I know when to take each one. And I've got an alarm on my phone, so I never miss a tablet.
Oh,
Yeah, it
that's
gave me a
great to
fright. I
know.
don't want it to happen again. So,
Okay, yeah. So are you experiencing any side effects from the medications?
I was a little bit tired for the first week or two after, but they put me through a rehab program, and I've been slowly getting better day by
Mhm.
day since then. It's been pretty good.
Okay, it's good to know that you're getting better. And do you have any shortness of breath?
No, no, it's still a little bit sore when I take a
Okay.
deep breath in, but I
Mhm.
think they cracked a few ribs when they did CPR on me.
Oh, wow, yeah. Okay. Are you able to I mean, how long can you walk without any discomfort?
Oh, I can unlimited. I can just keep going. Yeah, I'm trying to do lots of walks each day actually to try and keep fit again, and yeah, I'm doing that okay.
That's great. Okay. And how is your diet?
Well, I'm a bit bigger than I want to be, but my wife has me on a diet now since this, so yeah, I'm losing little bits of weight from it. Mm.
Okay. Any chest pain while you walk?
No, no, nothing at all. I did a little bit kind of first after the accident, but since then it's been nothing.
Okay. Okay, that's good. Do you measure your blood pressures at home?
Oh, it's another thing my wife got, one of those little machine things that goes around my arm.
Yeah.
We normally do it
Mm,
just once a day, and yeah, it's been pretty good.
okay. Can you tell me the number of your blood pressure?
Yeah, it's this morning. Where's my bit of paper here? It was 132 on 86.
Okay. 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 So and I in order to help you in the consultation, I also hope to know a little bit more about your background as well.
Yeah, sure.
So it says you're living with your wife, right?
Yeah, yeah, she looks after me.
Uh, okay. Do you have any financial difficulty?
No, I've been driving so long. I've actually got heaps of sick leave. I'm normally very well, so I've been using my sick leave and annual leave, and my work have been fantastic and helping kind of keep
Mm,
paying me while I'm going. So no, financially we're doing okay.
okay. Does your boss know about your situation?
Yeah, yeah. Well, we're in a pretty small town here, so word got out pretty quick that I'd almost kicked the bucket, and yeah, so they know about it.
Okay, okay. Because well, according to the guidelines here, it says that to be safe, it's recommended that you resume driving only 6 months after the cardiac arrest. So I would recommend to continue with the cardiac rehab first, and then well, to assess fitness for driving, it will be require a more comprehensive assessment. And I'd like to know your opinion about this. What do you think? And how do you think I can help you in that aspect?
Well, 6 months is a long time before I can get back to the bus. I mean, that is how I earn my money.
Yeah,
I've got a lot of sick leave and things, but I don't know about 6 months. That's a long time. I mean, I can at least just get in my
yeah,
own car and go to the shops and things though, yeah?
yeah, true indeed. So that's why I'd like to know a little bit more about your housing and finance and your relationship with your family and boss, etc., in order to help you go through this period of rehab. So first, I'd like to know, you said your boss knows about your situation, right?
Yeah,
Do you
yeah,
know
they know, yeah. I don't know if they're gonna be
which is
happy with
okay?
6 months though.
Yeah, so I mean, I can help you with that if you need any certificate to improve your, I mean, to give to your boss for this communication purpose. And I'm glad that you don't have any financial difficulty. So, but indeed, I understand that 6 months is a lot. So I'd like to know, are you the breadwinner of your family? Is there any other people who can support you and
No,
your
not
wife
not really. My
financially?
wife was a homemaker, so she's always just looked after the house, and I've always kind of looked after the finances. We've got a bit of savings there, but yeah, okay, we'll just have
Mm.
to tighten up a little bit, I guess, and see what we can keep together. But I can still drive my car though. You said.
Uh, I think, well, I think it needs to be 6 months after the arrest, and needs to be reviewed annually as well. The thing is that because obviously, you know, cardiac arrest is a very big thing, and I mean, it's unfortunate that it happened, but again, it's fortunate that you are recovering well, and I heard that you are taking your medications and coping, and you are going through the cardiac rehab like that. But I think it's still, we need to be very careful because driving, if anything that happens during driving, then it can be quite dangerous both for you and also for the passengers as well. Yeah.
Mm.
So I hope you
So I've just got to wait the
understand about
6
that.
months, and then I'm good. I can drive again.
I think it needs to be reviewed again to assess your fitness, such as your eyesight, and whether you uh, whether you feel very tired during the process, and whether your body is ready. And actually, I think to help you with that, I'm going to refer you to see occupational therapist. They can provide a comprehensive assessment for work capacity assessment, and then they'll also give me feedback regarding whether they think driving is safe for you. And at the same time, I'm glad you're having rehab for that, and I will also liaise with the physiotherapist to see how you're doing, and give you well, I review a condition regularly, and to see whether it's going to be safe for you.
Yeah,
Yeah, what do you
okay.
think about this?
Yeah, well, I'll
Yeah, okay.
make another appointment, I guess, to see you when that 6 months is up, and we can go from there. Yeah?
Yeah, and I will also review the occupational therapist's assessment, the evaluation for you, and I will track your progress, and hopefully you'll be suitable to resume driving uh, in that aspect. And also, yeah, I know it's a very long time, and financially it might be quite tight. So I think a medical social worker will be helpful They have a lot of resources to see whether they can support you financially, and you can apply for uh, disability allowance during this period with the government. And once you have the form and perform assessment for you and then the government will assess the duration for your disability allowance.
Yeah, that'd be great. But
Uh,
what about, because how my wife doesn't actually drive, how are we supposed to get our shopping and things?
oh, in the in in well there is for the medical social workers, they also can provide they can liaise with the government subsidy and NGOs to provide a meal delivery service. And I'm sure they'll be helpful to help you with that aspect. And also, I'd like to know what about your son and daughter? Do you have any son and daughter in
Oh,
your
yeah,
town to help you with?
they live far away though, so we they care about us, but it's a long way. They can't really come back to help out with this kind of stuff. I don't think they've got their own lives and their own families now, so I wouldn't want to be a bother.
Okay. How is the relationship with them?
Yeah, pretty good. They
Relationship?
come back for my birthday and Christmas.
Do they know about your situation?
Yeah, yeah, they came and saw me when I was in the hospital, and yeah, they stuck around for a week after I got home. But to be honest, I think we were glad when they left. You know, it was a bit full on. They brought some of the grandkids as well, and I got tired pretty easy at the start, so it was a bit much really. I was kind of more happy when the kids were gone.
Okay. Well, I totally understand that you don't want to make them worry. Yeah, that's very kind of you and understandable. Well, I think since it's a quite special time for you, more support is good. So I would encourage you to, talk about your worries and see if they can help you with social support like that as well. Yeah, and yeah. Um, so another thing also, I also hope to know, other than, worrying about buying things and the driving, is there any worries that concerns you that I can help you with?
I mean, I guess there's always that worry now that I'm going to have another heart attack. I mean, what can I do to try and prevent that happening again?
Okay. Yeah, I'll make sure to help you with this aspect. Well, heart attack is caused by blockage of your heart vessels, and that's caused by building up of cholesterol, basically fat, clogging up your blood vessels. So currently you're on medications which help to relieve that clog and to bring down the cholesterol. And there are several things that both you can do for yourself and I can also do things to help you. So of course, keeping with healthy lifestyle is important. And I'm glad that your wife is helping you with the diet. So in general, the rule is that taking a low carbohydrate, low fat, and low salt diet helps with preventing cardiovascular disease. And exercise is also very helpful. Well, you've just been through like a surgery for your heart condition. So currently, vigorous exercise is not recommended. So I recommend you to follow the cardiac rehab physiotherapist's recommendation. But if you get better later, have regular exercise of 30 minutes per day is proven to protect your heart as well as your brain, actually. And in
Yeah,
my
good.
record, it says you quit smoking, right?
Yeah,
Yeah.
yeah, gave those up a while back.
Yeah, that's one of the best thing you can do for your life.
Yeah.
I'm glad that you did it.
Yeah,
And the
thank you.
second thing is that you drink occasionally, right? You drink?
Yeah, yeah, have a few beers here and there, yeah.
Yeah. Drinking, I would recommend to stop drinking completely. I mean, maybe you can drink a bit in special situations, but drinking in general damages the heart, blood vessels, and liver as well. Yeah. And I'm here to follow up for you for your heart and also your driving issue. So I think I'll arrange a follow-up for you in about 1 month's time
Oh, thanks, Doc.
with blood test of your lipid
And
and
that's
blood
actually your
sugar.
time there. Time has finished. Well done. Well done. No, that was good. That was good. And particularly good. So you're in Hong Kong, is that correct? Or sitting Hong Kong
Yeah.
exams? You did
Yes.
fantastic. And I think as well, acknowledging that, this is set in Australia with different health system, different regulations. I think you absolutely smashed that case. Well done. So for these cases and for the RACGP exams, you'll always find, and I imagine your setup will probably be the same, if there are relevant kind of policies that need to be followed, and for this instance it was for the state of Victoria, they will include that section relevant. So it's more about interpreting the information provided as opposed to specific knowledge. They're not going to make you memorize every single state or every single location specific rules. The key things here, as you identified, was this is a man who can't go back to driving. And as you very sensitively did, looking at, well, what are the other things we can do? Because there's going to be those follow-on effects from that. So excellent that you picked up very quickly. Hey, look, I can see this is going to be a problem. Let's explore what is your social situation, your supports, your financial situation. I think that was brilliantly done and shows good finesse that you've seen a lot of patients and you already knew what to expect moving forward. I had set questions for you when you'd actually already ticked a few of the boxes before you'd even started talking about the license. So fantastic. So the 6-month wait, perfect. One of the requirements that is mentioned in there that they actually need a cardiologist or the specialist treating doctor, in this case would be a cardiologist, review as well before they're allowed to be medically cleared to drive. And I think you came close. I don't know if you actually specifically stated that. But I did like, though, you said, look, we're going to be checking in as well and organising other assessments to be done. I think it's not a requirement, but it's not, it is a good idea rather to have that OT driving assessment done to just make sure everything is good if there are any concerns. But I wouldn't say it's something that every single patient had to do, more if they're getting ongoing symptoms and you're not quite sure, are they actually safe to be driving again? This patient here was intentionally quite well and had recovered reasonably well. So in that case there, I probably wouldn't, but you'd be highlighting those red flag things to be looking at for the chest pains, in particular if they're not resolving with rest or with things like GTN, any kind of arrhythmias or palpitations, any syncopal events, then they really need to be seeing a cardiologist as soon as possible. The next part then, I think you did fantastic and was mentioned by the chat here. Here you did mention getting government support. You can get what's called a Centrelink certificate here, which can give you exclusion from having to work, and there can be government support and subsidies that go along with that. Keshminder from chat has also thrown in a mental health check. It is incredibly common to have significant mental health issues, depression, a survivor guilt is also quite common after cardiac arrest. And so just touch on that, and you can even just have kind of one line in there of, hey, look, this is a really big life event. I can understand if it had a bit of an impact on your mental health. How are you going there? Are you sleeping well? Do you feel like you're depressed? Do you feel like you're anxious? It's easy to get hooked up on looking after your heart. Has this become an obsession for you? Just kind of tease out there any details. But I think all in all, your organic conversations probably would have picked up if there were things there. Kashmir has also thrown in, if you know the specific targets that you're trying to hit for things like LDL, blood pressure, feel free to just throw them out. It gives that little bit of extra polish to the examiner that, you know what those guidelines are, acknowledging that a large part of these exams is really about your communication skills and techniques. So even if you just say, look, we're targeting low cholesterol levels, that will probably get you through. But if you do know those specific numbers, specific targets, it's that extra polish to say this is consultant level knowledge and expertise. Does that make sense?
Yeah.
Cool. So all in all, absolutely fantastic. One interesting thing that happened in your case is that your connection there a few times your data rate actually dropped, and so your video actually shrunk down to a very small size. Are you on a Wi-Fi or a fixed connection there?
Wi-Fi.
Cool.
Wi-Fi.
Yep. 99.9% of the time, that's perfectly fine. But there'll be on the day or like tonight, if there are any connection issues and it drops the quality, it's one of those things that shouldn't matter, but does give that little bit of kind of impression of unpreparedness. So when you're actually sitting the exams, make sure you have a wide connection to whatever computer you're using. Try to avoid Wi-Fi or anything where the signal might drop out or have some kind of interference, just to give you the best chance possible of maintaining a good connection all the way through.
Mm.
Otherwise, fantastic. Well done. When's your exam?
Oh, because I'm actually taking the exam, the Hong Kong equivalent exam.
Yep.
For RACGP.
Yep.
So it's on the 27th of October.
Excellent.
And yes, because they changed the format to be similar to the RACGP,
CCE, yeah.
which is quite different.
No,
Different
good.
from the previous.
Yeah. I think you're doing really, really well. I can see you're an excellent doctor. You're obviously practicing. Whatever you're doing, keep it up. You're going to be fine for the day.
Thank you.
No worries.
Thank you.
I'll leave you there then. I'll pop you out from here and we'll jump back to YouTube. So, 2 cases done. Thank you for those popping some feedback in at the end as well. For those that are coming through, some of the competent candidate information here is to correctly apply the Ausroads Assessing Fitness to Drive guidelines. So for those who are in Australia, this should be something that you should be very, very familiar with, and it's something that you should be using pretty much every day. It is Australia-wide, but you do need to be aware that there are occasional regional quirks that can be state to state, but you'll know those based on your specific work location. Now, it's also important to differentiate between the private versus commercial driving, and in a case like an AMI, it tends to be pretty much the same across the board, and important to flag that, hey, yes, you can't drive your commercial bus, but you also can't drive your private car as well. And to give those appropriate follow-up and management strategies in place there, which I think was demonstrated quite well. I think also, as was done here, explaining the rationale for driving restrictions clearly and empathetically. So saying, hey, look, you are in that high-risk window, so we want to make sure nothing bad happens. You drive a school bus. Can you imagine if something happened and people were to be injured? It's a pretty big deal there. It's a really good way to kind of get that message across that, yes, it's a pain in the backside, but it's there for a reason. And, of course, emphasizing the importance of safety for Jeff and others on the road. So using those clinical guidelines, as was done again, going through what are our other targets for looking after your cardiovascular after some of these events, and demonstrating understanding the risks and necessary precautions following a serious cardiac event.